short presentations. First presentation is from a group from Brescia, Italy. Gianluigi Bisleri, successful endoscopic surgical ablation in persistent atrial fibrillation is associated with improved atrial function at short-term follow-up.
Thanks, Piotr. I'm glad to present here at the Society our evaluation from the echocardiographic standpoint of patients undergoing minimally invasive AF surgery, which has steadily evolved and improved over the past decade. And we've seen, from a general standpoint, promising results also in patients with persistent AF. But there are kind of positive data regarding the atrial function, especially in this subset of patients with standalone thoracoscopic ablation. And especially, obviously, after following, after sinus rhythm restoration. So also, this is due to the lack of often standardized protocols when reporting the atrial function evaluation. And just very quickly, I just wanted to go back to what are the different phases in atrial function. We actually is a bit more complex than what we often think. It's not just a diastolic and systolic phase. As you can see, the atrium usually has a reservoir function, conduit function, and booster pump function. That's the only active part of the atrial contraction. And there are also many other physiological factors that may influence how the atrium is working. We have different ways to assess, echo or MRI, and in the present study, with patients undergoing closed chest surgical ablation, as you can see, out of 60 patients undergoing the box lesion set, we evaluated only the patients with sinus rhythm at 6 months follow-up, and by means of echocardiographic analysis. As I just mentioned, the approach is a fully thoracoscopic, so just with right ports on the right-sided ports in the chest, and a box lesion set being performed. So basically what you will see are the data regarding the contraction, or anyway the function of the atrium following an isolated box lesion set. The echo analysis, obviously, I think nobody can claim that we have a comprehensive set of data, but I think it's pretty interesting what we have been working on, and obviously we expect maybe to improve further on. So you can see many parameters to be taken into account. I just want to let you very quickly in this short time understand that the combination of many of these parameters are providing us with total empty fraction, passive empty fraction, or active empty fraction. And basically, in this very busy slide, as you can see, the left ventricular ejection fraction was improved, but not statistically significant. There was all the other parameters in terms of anteroposterior diameter, area, and volumes were improved at 6 months follow-up. And similarly, the total empty fraction, passive and active empty fractions were improved. And I just wanted to simplify, comparing to the slides I presented before. Basically, you can see an improvement both in the reservoir, conduit, or booster function. So in conclusion, the evaluation of atrial function following surgical ablation require multiple parameters to be analyzed. And if we have sinus rhythm restoration, we could already detect at 6 months an improvement in the function. Obviously, we got many other elements to be taken into account that also require longer follow-up to be confirmed. Thank you.
Thank you very much, Gianluigi. And next presenter is Dr. Hatam, and he will present video-assisted pericardioscopic surgery for epimyocarditis.